Hi, my name is Rosie Beardsley. I'm the Nurse Advisor to the Healthy Dying for People with Disability project for Live Tasmania. The Healthy Dying for People with Disability project aims to help people with an intellectual disability who are living with a life-limiting illness have a good experience at end of life and in death. The project does this by supporting and providing some training and familiarisation to the toolkit that we've developed for disability support workers and for healthcare providers. And they're really practical tools to improve communication, documentation and coordination of care. The reason that we're undertaking the Healthy Dying for People with Disability project is the research and certainly the lived experience of people with intellectual disability is that they are facing much greater challenges than those without intellectual disability. They experience death at a younger age, they have multi-comorbidities, they sometimes aren't referred to specialist palliative care services in a timely manner, and also they mightn't actually get access to the end-of-life care that they deserve. And one of the other reasons that we undertook the project was to really improve communication and documentation between providers, both in the disability and the healthcare sector. We've developed an evidence-informed toolkit that really provides some practical tools for people who actually work within the disability sector and also in health about improving, and the tools are aimed at really supporting the workers and improving communication, documentation, accountability and coordination. So the Communicating for End-of-Life toolkit was developed in consultation with people with intellectual disability with lived experience and their carers and families and providers in the disability and the healthcare sector. And it's like a transition of care toolkit to really improve communication as people move between sectors across the disability and the healthcare sector. Certainly our research and the experiences of those working within the sector really highlights the need for much better communication between the disability and different parts of the healthcare system. And that's not to say that people aren't doing a good job, it's just about how we can really support people to understand the challenges that both sectors have. And the tools within the toolkit really are just a way and a means of supporting the workforce out there to consider what are the important points of communication and documentation to better support people with intellectual disability who are with a life-limiting illness or who are dying. The development of the toolkit has been a really interesting journey. We've actually heard from people with intellectual disability with life-limiting illness. We've also heard from carers, families, and people who work within the disability sector and in the healthcare sector. We felt it was really important to capture the voices of people who are going to be using the toolkit so that it's actually relevant and accessible, with the main aim to make sure that people with intellectual disability have a good death. The toolkit is a really practical based, and it's got a series of tools. There's probably about 8 of them. They're things like My Hospital Passport, Isobar Shared, which is a clinical handover based tool and resource. And in the toolkit there's the top 10 tips for breaking bad news and Stop and Watch, which really is a very practical tool that can help support workers identify any tiny changes that they might see in the person that they support. And if there's 3 or more symptoms that they recognise, how they can escalate that concern up to their team leaders. So there's a series of things that organisations might just want to pick up 1, 2, or in fact the entire toolkit to support their teams in the work that they do. You can download the toolkit on the Live Tasmania website, and you can really familiarise yourself with the background of the need for the toolkit and how to improve the experiences of people who are living with a life-limiting illness. And the toolkit really are a way in which we want to work with each other between the disability and the healthcare sector. You can implement them through your policy and processes and systems and train your workforce in those tools so that they can feel much more supported in identifying any deterioration in the people they support and understand how they can access the care to better support the person who is dying. You can go to the Live Tasmania website, which will give you some contact details there. You could also attend one of our fantastic workshops. They're very interactive and very casual and provides you the opportunity to really share your experiences, expertise and concerns and about how we can better support you in your practice.